Good Friday morning, everyone. This is Vicki Bird giving you a legislative update for this week. Today is the 5th of March already. This is day 2 of transmittal. Transmittal this year for the 2021 legislature is Thursday and Friday. Often it's a week, but it's just 2 days this year as there's much work to be done. As many of you might know, right to work in Montana got voted down and was not supported. The only right to work bill that was passed out of the House was 289, sponsor was Matt Regier. And this just essentially codifies Janus, which is federal law, which we've been compliant with since the day after Janus went through at the national level. So for all our collective bargaining nurses, we are rest assured that we can still hold our collective voice, and Mary Munger would be very, very proud. And as one nurse wrote into our office and said, her blue eyes are definitely sparkling from heaven, and proud of all the good work that everyone did, nurses and all of our labor community and our communities that support these workers. So we should be very proud of that. And thank you to the SWAT team for being mobile and being active and engaged. And when we've reached out to all members, thank you for being engaged. We're halfway through. So with that being said, the second half of the legislature will start on Monday. All the bills that have passed the House and or the Senate before this transmittal date will now flip houses and have to go through either the House or the Senate to move on to the governor's desk. So we continue to push back on any public health bills that strips public health officials, nurses, doctors of their profession, of their duties, of their recommendations. We want to continue to embrace public health. They've been critical as we're in the middle of a pandemic. Also, I want all of our members to know, and all of our non-members if they happen to watch, please know that we have been reaching out to you a lot, and I know it's overwhelming. There's a ton of emails and a ton of texts, but this is important, and this is your voice, and I can bring that voice forward through the umbrella of M&A, and that's why I took this position, so I can advocate for you to better advocate for your patients. On the bright side, M&A has passed through the House with the help of sponsor Mary Cafaro, House Bill 495. And this is essentially a cleanup bill for the APRNs. As last session we passed signature authority, but I've heard from many APRNs that they've had to literally print off the bill, Senate Bill 94, which is law, print up the law, staple it to a form that has been rejected or not accepted because an APRN signed it, which is within their scope. So this cleanup bill, once we started digging into it, we found out that there's more than 277 statutes that are not updated, they're old, they're antiquated, not to mention all the forms and documents at DPHHS. One such law statute that we still have in MCA is regarding long-term care, where it literally identifies a physician as an APRN with an advanced degree. So I know the APRNs aren't going to like that and the physicians aren't going to like that. Both can be doctorate prepared. APRN is not a physician and vice versa. So we've been working really hard to clean that up. Our APRN conference is this weekend. I can't wait to inform them about the updates. Please go to our website. Our administrative staff, Jennifer, has been phenomenal keeping that up to date. It's called Legislative Roll-Up to Transmittal is kind of a quick summary on all the bills and whether they got tabled or they passed. Underneath that is all the bill information. It's the bills and the either opponent or proponent testimony that came from M&A once I reach out to the members to get their voice and follow our legislative platform. So please know the second half of the legislature, we're going to continue to reach out to our SWAT team. Thank you for participating, and to all our members when we need input on these critical bills, especially when it relates to public health, to nursing, to school nurses, to acute care nurses, to our advanced practice nurses. And we work with our physician's assistants, we work with our MDs, we work with the Hospital Association, Medical Association, and we're working with the Physician Assistant Association so that we can all ultimately just take better care of our patients. Thanks for listening. I'm just under 5 minutes, and we'll talk to you next week.